Hi everyone, today we will be discussing group therapy and constraint-induced language therapy. The presenters are Misha O'Donnell, Kristen Kramer, and Megan Smith. First off, we will quickly review what aphasia is. It's a communication disorder that is due to damage in the language areas of the brain. There are numerous types of treatment available, and the type used is based on the individual needs and goals of the person with aphasia. So today we will be discussing group therapy. Group therapy for people with aphasia emerged when the focus of therapy shifted from strictly rehabilitation of the impairment to the well-being and life participation of the individual. Group therapy first emerged in the 1940s to 1950s after World War II. Soldiers returned from war with brain damage and sought treatment for their impairments. The treatment was done in groups and targeted speaking, writing, reading, math, and social skills. Aphasia treatment groups continue to be a method of treatment in both military and non-military settings. And 40 years later, in the late 1980s, healthcare and insurance policies reduced the number of individual treatment sessions patients were able to receive. This, combined with the realization of the importance of including well-being and life skills in the treatment of aphasia, led to the growth and popularity of group therapy. Regardless of the therapy approach used, there are a number of factors that affect the dynamics of the group. Groups may be formed based on the same general level of severity of aphasia, the same form of aphasia, or without regard to severity level or classification at all. The makeup of the group is not as important as the opportunity for each member to participate in a safe environment. There is also a strong psycho-emotional aspect to group therapy. The dynamic of the group allows for individuals in the earlier and often more severe stages of recovery to interact with other individuals who have advanced through that stage already. This can give hope to people with aphasia in the earlier stages of recovery and significantly improve their prognosis. The ideal setup for a group session would be for the patients to sit around a table with the communication aiding materials dispersed in the middle of the table. This ensures that each patient has access to the items. To aid with nonverbal forms of communication, the following materials would be useful during group therapy sessions: a blackboard or whiteboard with markers and erasers, a pad of unlined paper, a felt tip pen for each participant, boxes of crayons or colored markers, a map of the local area and of the United States and of the world, and these materials may be used as appropriate depending on the activity and topic of conversation.
There are 5 different approaches to group therapy that help people with aphasia practice refining pragmatic aspects of language with their peers and generalize the use of functional language to communicate. In the first approach, people with aphasia have the opportunity to apply language and techniques they have learned in individual therapy with a group of people. The second approach involves indirect language treatment. This may include conversational role-playing, field trips, discussions of current events or topics of the patient's choice, or general social exchanges. The third approach includes patients using social functional language activities. The fourth approach is used as a transitional treatment for people with aphasia. It can help them to advance from practicing their language in a clinical setting to being prepared for real-world conversational opportunities. The fifth and last approach is a maintenance approach, where the individuals attend social groups for the purpose of indirectly practicing language. Group therapy is beneficial for patients in many ways. It falls under the category of social therapy approaches for people with aphasia. In general, it allows individuals to work with people who have the same neurological disorder. This typically helps them feel more comfortable with less fear of judgment. It is especially important for individuals who tend to shy away from communication due to aphasia. The skills and techniques used in individual therapy can be translated into the more natural setting of group therapy. Furthermore, everyone in attendance participates in supporting and guiding the other members of the group. Ellman and Bernstein-Ellis found that group aphasia therapy was most effective immediately post-onset of chronic aphasia. They studied people with aphasia who were at least 6 months post-onset and had received the number of insurance-allotted individual therapy sessions. The patients who received group therapy immediately post-onset showed significantly improved scores on standardized tests compared with patients who deferred treatment. This improvement was not immediate, but rather was observed over time. And this study just adds support to the use of group therapy. The speech-language pathologist also plays a really important role in group therapy. The role of the SLP in group therapy is to ensure that group members have adequate opportunities in the following areas. So, initiating various forms of communicative acts, practicing communication skills learned in therapy, engaging in turn-taking, maintaining good social pragmatic skills, interacting with various communicative partners, learning practical information from others who have experienced living with aphasia, and receiving and offering psychosocial and emotional support. In order to facilitate these opportunities, it's important for the SLPs to provide understandable topics of conversation and activities that are relevant to the needs and interests of all members of the group. Another important factor for the SLP to consider is that the potential emotional impact of therapy material. People with aphasia often respond better to emotionally charged material, so it's important to consider this during the selection of resources for group activities.
Happy birthday to you. That's number 1, right? Here's number 2. Happy birthday to you.
The look on your face. Jimmy, I think you might have changed your mind on that one. Are you changing to number 1? Yeah, the look on your face kind of said it all.
Sometimes hearing the word that maybe doesn't go there, wow, that really sticks out. I can tell. You gave a big thumbs down right away. Like, no way, that does not work. All right, so let's try a different song, okay? How about... The answer, my friend, is blowing in the...
Is that here?
The answer, my friend, is blowing in the... Nice job, guys. I think Allison and I heard you all say the missing word. That's exactly what we want you to do.
Yeah.
Okay? Now, find it on the board.
Going with number 2. Blowing in the... I can guess with that one? Okay. Curtis, what do you think? We're split again. Blowing in the sand,
Oh, yeah.
blowing in the wind. I made them probably too similar.
Yes.
Should we listen to them maybe in the song?
Okay. Number 1. The answer, my friend, is blowing in the sand.
That was number 1.
Yeah.
Okay.
There's number 2. The answer, my friend, is blowing in the wind.
Yeah.
Oh! Well, you guys have a whole different reaction for that one.
I think we found it. Blowing in the...
Ah.
Got it.
Sometimes saying that word and reading that word and writing that word, it's different parts of our brain doing the work, right? Sometimes it might be easier to say it in a song than it is to read it or to write it. So this is why we're practicing kind of many different ways to find the right word. Nice job, you guys.
So in this video, you saw a group therapy session with 2 people leading the session. And as you can see, the patients are all in a preferred seating arrangement of a circle, so they can all see each other. They all have access to the verbal cues of speech, and they also all are able to also hear everything. So you can notice too that along with music, they also use a whiteboard to write down different words to show what was being said, and that's just another strategy of finding words for patients dealing with aphasia. The leader of the group also gave them an opportunity to fill in words to common songs that they all would be able to know. And this was effective in them giving an answer, but then they were also able to hear their answer back and then decide if what they had said was correct or not. In contrast to group therapy, constraint-induced language therapy, or CILT, is a relatively new form of aphasia therapy. This treatment methodology stems from constraint-induced movement therapy, and in that, research has shown that sensory, motor, and cognitive activities can stimulate and activate the mature nervous system. The neuroplastic changes of the brain that occur as a result of these activities are called cortical reorganization. And this is what has been evidenced in patients suffering from hemiplegia who have shown success in being forced to use their weakened limb. So with this therapy, the forced use and intensive practice of a specific task can cause behavioral and neural changes. However, Halpern and Goldfarb did note that further research is needed to confirm the efficacy of this treatment method. So the main principles of this treatment method are deal with constraint, that avoiding the compensation by eliminating the use of compensatory strategies. Also force use, that to force the use of the impaired strategy by putting individuals in situations where they use it to achieve a meaningful goal. And then also mass practice, so constraint and forced use often. So to use those two together and to practice them in real situations. So the principles are based on the idea that if the individual's compensation for a deficit is always constrained, the individual's ability to use the weakened strategies will increase substantially. So an example to this would be to have a barrier set up between two individuals with aphasia who are playing a card game, and the participants with aphasia are forced to verbally request and deny cards from the other players, since their compensatory strategy of using gestures and nonverbal language to communicate is constrained by the barrier. So there are three specific studies that we looked at when dealing with constraint-induced language therapy. The first study was with Pulvermuller et al., and they researched 10 patients who received the CILT performed better on post-treatment tests than the control group. Both of the groups were given the same amount of treatment. The CILT group had 3 hours of therapy every weekday over a 2-week period, whereas the control group had the same number of total hours, but the treatment was less frequent and divided over 4 weeks. So it specifically focused on the intensity of treatment. And within the CILT group, all communication had to be done verbally. Patients were not allowed to use gestures. Also with the CILT group, they showed increased improvements on 6 of the 8 language measures that were assessed pre- and post-treatment. But more specifically, the measures that analyzed the patient's ability to communicate in everyday situations increased significantly in the CILT group only. So the more intense the treatment, the better results that they found. Also in another study, Mosaico, Coelho, and Myers, they studied 8 patients with varying severity and categorization of aphasia. And this study was done very recently in 2016. The participants were paired with dyads and given varying intensities of CILT therapy. The participants who received the intense dosage of the therapy improved more dramatically than those who received a less dosage of the therapy. This helps to provide evidence that the CILT is effective in general, and it is more effective when given an intense dose. So then our third study was by Meinzer, Juja, Barthel, Albert, and Rockstroh, and they found that improved language function as a result of CIAT remained stable over a 6-month follow-up period. So the authors, they found that these improvements in everyday communication remained above baseline, and family members and caregivers reported further improvement in the quality of everyday communication. These results also were not limited by age, severity, or duration of aphasia. So overall, the research currently is showing that there is proof that this therapy does work and that it's stable. However, most of the studies are done on very small groups, and so it would be beneficial to continue research in this area and expand the reach of it. In the following video, we have an example of what constraint-induced language therapy can look like, and this is an example of one of the barrier strategies that we had talked about before. As you're watching, I encourage you to look specifically at what the patients are doing and maybe what kinds of bodily movements or things you see them want to make, and just pay close attention to what the patients are doing with both their bodies and then what is coming out of their mouths.
So for our class participation,
Do you have a red or white card and a black sandals. Do you have a white car and a white sandals?
Sandals?
Uh-huh.
Cart?
Uh-huh.
No, we don't.
So, for instance, the whole phrase is that I don't have.
I don't have a white car or a white
Just gives us.
sandal.
Good.
Good job, Franciscan.
Thank you.
Okay. Well, you, Kevin. Yes. Do you have a white milk and a and a it's really there. It's an apple or a no a white. I just want to go this one and this one. White milk and a pizza pie, apple pie. Thank you.
Okay, so. So they're all. Yes.
It's this one, because you don't have either one, so you're gonna
Alright, I do not have milk or apple pie.
It's a hard word. Okay, your turn.
Oh,
Who are you gonna ask?
well, Kevin. Do you have stop or zoo voice?
Does anybody have a shop coat?
Francis, I do not have stop or
Francis, I don't have a shop coat. Francis, I do not have a shop coat. But I do have a shop coat. I do have a shop coat picture. I think I have a picture of the mask, but I have a picture of the mask. So, does anybody have a picture of Albertsons?
Francis, I do not have a picture of Albert, a large Albert. I don't have a picture of large Albertsons.
I have a large picture of Albertsons.
Good. And I do not have a picture of a large Albertsons. Does anybody have a picture of two lambs?
Francis, I do not have a picture of a true lamb. I don't have a picture of the two lambs.
I don't have a picture of the two lambs.
But I have a picture of two lambs.
Good. Just get it done.
Gosh. Does anybody have a picture of a cruise ship?
Francis, I do not have a picture of a What's the picture of cruise ship?
I did not have a picture of a cruise ship. Well, I don't have a picture of this one. I did have a picture of many others that I went on, but I do have this one.
So for our class participation activity, we came up with 2 questions for you guys to answer. The first question is, why did therapy evolve from individual therapy to group therapy after World War II? And the second question is more of just an activity, and it's just for you to give an example of a constraint-induced language therapy activity. So an activity where the individual's compensatory strategies would be constrained in order for them to use their impaired strategies. The following slide just shows the references that we used for our presentation. Thanks so much for watching and have a great day.